All right, patient care part 2. We're continuing on with some legal terms. So definitely I would make some flashcards of these if you have trouble sort of deciphering between the two, right? So assault will be the threat, considering your word choice and tone. And battery is the actually touching or performing a radiograph on the wrong patient or the wrong part. I think of assault as A before B, so assault can be the threat before the battery. Invasion of privacy, so think about HIPAA with 2 A's, right? Confidentiality for your patient, not accessing medical records that you don't need to be involved in. False imprisonment, not allowing the patient to leave or putting on some sort of restraints that they don't necessarily need. Understanding the difference between restraint and immobilization. So immobilization for us as x-ray techs, we might use sponges to temporarily keep them in a position for their x-ray. A restraint, which you might see up on the floors, like similar to these feet or wrist restraints, those require an order from a doctor, and it restricts the patient's freedom. It's not, usually temporarily for a few seconds like ours are. So we use sponges. Your pigostat here for your PD chest. You're going to tell your parent that you're going to put the child in there and then just use it to kind of keep them immobilized for their x-ray to keep them safe and reduce the amount of exposure due to motion. Okay, things like that. So restraint has to be ordered by a physician. So keep that in your brain, okay? More legal terms, some that I think people confuse quite a bit is libel and slander. Libel is the written and slander is verbal defamation. So if you think S for spoken, S for slander. Negligence, what would be considered negligent as far as x-ray techs go? So negligence essentially is failure to provide reasonable care and caution. Making sure the bed rails are up, so before you drive that stretcher to the ER or when you do the portable exam on a patient that you don't leave their bed rails down so that they could potentially roll out of bed. So make sure we're putting bed rails up, we're putting brakes on a wheelchair before the patient is either standing up or sitting back down into it, things like that. Tort has to cause an injury. It can either be intentional or unintentional. The legal doctrines that I want you to know is respondent superior, that is let the master answer. So the employer is held responsible for the actions of the employee. And I was saying this one wrong, res ipsa loquitur, the thing speaks for itself. So the defendant, the individual being sued, has to prove his or her innocence. Okay, so libel and slander, make sure libel is written, slander is spoken, and it's usually negative. We went over this a little bit already, but restraint versus immobilization. Immobilization is used in x-ray to reduce motion. It's temporary. So your positioning aids are used to eliminate motion in our artifact. Restraint requires a doctor order. This is not performed by a radiographer. There's a couple of types here. It could be physical, restraining limbs, environmental, a secluded room, mechanical. It might be a seatbelt situation or a chair with, a locking table. And then it could be possibly medication, sort of types of things, okay? 7 C's of malpractice. Competence of professional standards, compliance, charting, right? Charting. Communication with everyone, confidentiality, you want to protect medical information, courtesy and attitude and rapport, and then carefulness. Use caution when dealing with patients. So 7 C's. ART Code of Ethics, knowing your code of ethics, and there is 11 codes. So reviewing those would be beneficial to you prior to your ART exam. what is essentially the point of the code of ethics, right? It's the first part of the standard of ethics. It's a guide for certificate holders and candidates to evaluate their professional conduct as it relates to patients, healthcare, consumers, employees, colleagues, and other members of the healthcare team.